Well, hi, everyone. My name is Tanner Pearson. I am the disease prevention specialist for the Umatilla County Public Health Department. A little background about myself. I got my bachelor's degree from EOU in molecular biology, and I just recently got my master's degree from Drexel University in immunology. So the focus of today, I really wanted to touch on is HIV and different prevention methods that often get missed in rural areas. And currently, right now in Umatilla County, we are experiencing a HIV cluster outbreak. The CDC even has its eye on it right now. So I think that this is a great time to kind of talk about some prevention tips that are not frequently utilized in rural areas. Here's my contact information. So I'm kind of just giving a brief overview of HIV, how it infects, and the PrEP and PEP medications that are utilized. But if you want more in-depth information, you can always reach out to me and I can get you more resources and information about this. So what is HIV? The acronym stands for Human Immunodeficiency Virus. And this is a virus that infects cells of the immune system. And so it, over time, depletes a specific type of cell in the immune system. So whoever is infected with HIV, if you do not get treated, you will become immunocompromised, and it leaves you at risk for a lot of different health issues. The infection with HIV is lifelong. There's no cure currently, but it can be managed with medication and people can live happy, long, healthy lives. There are several transmission methods. The most common that are out there is through unprotected vaginal or anal sex, and then also through sharing needles, syringes, and other injection-based equipment. Anal sex, receptive anal sex, is primarily the most risky. You end up, during intercourse, developing micro tears in your mucosal membranes along that pathway, and that leaves you susceptible to the virus entering your body a lot easier. So that one is the most risky if you have unprotected receptive anal sex. You can still get HIV through other forms of sex as well. That one is just the most common to acquire it. I won't go through specifically what all of these are, but when HIV enters your body, it targets specific cells that have a receptor called CD4. And CD4 is kind of like the lock that prevents it from getting into your body. Or it's the key, essentially, that the virus uses to enter your body. And so if it doesn't have that receptor, then it can't get in. So CD4 expressing cells, like these ones, are susceptible to infection. A lot of these different lymphocytes, if you've ever heard of T cells before, they do a wide variety of functions in the immune system. They're really important for all kinds of infections, viral, bacterial, fungal, parasitic. They help prevent cancer from starting. They regulate the immune system so you don't develop an autoimmune disorder or develop certain allergies. So these are really, really important cells. And over time, we lose them through an HIV infection. And so it leaves you susceptible to lots of health issues. This is an overview of the life cycle of HIV when it enters into your body. I mostly just wanted to use this to point out that the CD4 receptor is there, and that's exactly what the virus uses to get into your cells. There are some other immune cells that have CD4 receptors on them, but they're not as commonly expressed on those cells, like macrophages, monocytes, dendritic cells. Those are kind of your first responders. They're the ones who show up first on the scene when a pathogen gets in your body. So they're also really important. There are several phases that an HIV infection goes through. If you are unmanaged with medication, primarily it starts with the acute phase. This is a symptomatic phase that occurs about 2 to 4 weeks after exposure to HIV. It's characterized with flu-like symptoms, so, fever, chills, headache, body aches. Sometimes you can get respiratory type symptoms. And there's some other symptoms that fall in there, but those are the most common. But up to 30% of acute cases do not experience any symptoms. And during this phase, your viral load is extremely high. So the amount of virus that's in your body is in a really high amount. So when you expose somebody else to HIV, you're transmitting a lot of virus, which makes it more contagious for other people. Because it's often asymptomatic, that means that it's really, really easily spread during this phase. People don't know that they have it yet. And when you don't know, you're not taking the right precautions to protect your partners or the people that you engage with in those risky behaviors. If you start ART, which is antiretroviral therapy, that's a medication that we use to treat HIV and manage it. This is the most important phase that you can start it in if you are aware of your HIV status. It has the best clinical outcomes down the road. So when you start that medication in this phase, it allows you to develop a lower viral peak. So that means that later down the road, you are less susceptible to opportunistic infections, HIV-associated cancers, and it gets your viral load much, much lower in a faster manner than any other phase of infection. And so you can remain the healthiest the longest if you start medication during that phase. The second phase that kind of follows after the acute phase is the chronic phase. This is typically asymptomatic. All those flu-like symptoms kind of resolve, and then you end up having a clinical latency. So the virus hides within those cells, and it stops replicating itself in a very, very fast manner. It just does it every so often to keep it alive, essentially, in your body. But it's doing it at such a low level that your immune system isn't removing it because it's not detecting it at a high amount. So it's kind of like camouflaging itself for an extended period of time so it doesn't get removed from the body. And this typically occurs over a span of many years. If you do not end up getting treated for HIV with medication, you will eventually have a CD4 count that gets very, very, very low and usually occurs around the 10-year mark if you're untreated, and then you can progress into the next phase, which is the most critical of the phases. If you end up starting medication with this one, your outlook tends to get a lot better. Your CD4 numbers can replenish themselves as your viral load goes down. So you can still live long, healthy life if you start medication during the chronic phase, but you are a little bit more at risk for some of those things that I mentioned earlier. It is less contagious than the acute phase, but you can still transmit it during this phase. If your viral load is detectable, it's transmittable. But if you're on medication for long enough and your viral load is undetectable on a laboratory test, it is essentially untransmittable. You cannot give it to somebody else. You still have it, but you can't give it to anybody else. Once you reach a certain level of CD4 cells in your body, if it's below 200 cells per cubic millimeter of blood, that means that you have now passed into the AIDS phase of the disease. AIDS stands for acquired immunodeficiency syndrome. And AIDS is not an infection itself. It's more just the status of your immune system caused by HIV infection. As you enter into the AIDS phase, your viral load goes way, way, way up. So over time, you were having just a slow increase of your viral load during the chronic phase. But once your CD4 count dropped low enough, it skyrockets the viral load. Your CD4 count goes so low that your immune system is extremely compromised and it leaves you at risk for all kinds of infections. Typically, we like to talk about the opportunistic infections. These are pathogens that cause infections that people with competent immune systems, healthy immune systems, typically don't get when they're exposed to them. But if your immune system is very, very damaged, like in AIDS patients, they are at risk for all kinds of different diseases. In that list, there's several different kinds of fungal infections that can cause meningitis, pneumonia. There's some parasitic infections, viral infections, and bacterial infections that if you have a healthy immune system and you're exposed to it, it probably won't affect you, but these can be extremely deadly in somebody who is in the AIDS phase of the disease. This is kind of a good picture that describes the trajectory of the viral load and your CD4 count as you progress over time. So before the infection, you have your CD4 cells and a healthy amount, which is exactly what we want. If you get infected with HIV and start in that early acute phase, you see that the viral load is really, really high because it's replicating very fast within your system. And if you notice, you lose some of those CD4 cells. Not a ton. You're still relatively healthy in terms of your immune system, but not as good as it could be. And that occurs usually over weeks to months. Once you reach a certain point, you move into that chronic phase I talked about, and your viral load will start to slow down, decrease. Reason being, it's doing that hiding out camouflage phase, and so it's not replicating itself very fast. It's just not producing very much of itself, making it kind of plateau a little bit there. However, over time, several years goes by without any treatment, and your CD4 cells will slowly decrease, and your viral load will slowly increase. Once you reach that certain point of CD4 cells being extremely low, the virus takes advantage of that now and replicates really, really fast, and that's when you move into that AIDS phase. So in terms of prevention, there's always the typically talked about forms, protected sex through condoms and internal condoms. There's obviously education on not sharing any of your injection equipment. For people who are pregnant, getting started on medication can help prevent it from transmitting to your child in utero. And also, if you are breastfeeding, you can transmit the virus. So it's important to be in contact with your OB/GYN and pediatrician for your child on breastfeeding tips. There's medication now that is not highly utilized in rural areas called PrEP. And PrEP is a pre-exposure prophylactic drug. So it prevents HIV from starting, and you take this medication every single day so that way you don't get it if you get exposed. The two options that are out there that are pill forms you take every single day. There is one injectable form that is relatively new, and that one is given every 2 months, and it's given in your doctor's office. So it's not like a take-home injectable medicine. You do have to have an office visit for that. But for people who are not good at taking pills every single day, just really don't want to go through that cycle of having to remember that, I think it's just way easier to schedule an appointment with your doctor every 2 months to get a quick injection. That may be the best option. There's a lot of options for what works best for you. It is only prescribed to people who are HIV negative, so you will have to be tested before you start the medication. And if you are HIV positive, you are not qualified to take these medicines in the form that they are. They are antiviral medications that do treat HIV, but in the doses and formulations that they're in these kinds, it's not effective enough to treat an active infection. So that's why it's only for people who are HIV negative, and the intent is for prevention. When people are exposed to HIV through unprotected sex and they are on PrEP, it is effective at about 99% to prevent HIV from initiating an infection. If you are exposed through sharing injection equipment with somebody who's HIV positive, PrEP is about 74% effective at preventing that infection. So a little bit more risky, reason being it's going straight into your bloodstream through that method. So it may be able to kind of cling on to those CD4 cells a lot faster and start an infection so it doesn't go away. There's also PEP that is available, and that's post-exposure prophylaxis. That is it's a regimen for 28 days that you take HIV therapeutic medication, and you have to take it within 72 hours of the exposure, and it is highly likely that it will prevent the infection. It's not 100%, but starting it sooner during that 72-hour window increases your chances of not getting HIV. This is more of an emergency-based kind of option. It shouldn't be used frequently. If you are exposed frequently and are at high risk, PrEP is the better option rather than getting PEP every single time that you are exposed. So the rules for PrEP. There's some criteria that has to be met. Obviously, I mentioned that you have to be HIV negative, so you'll get a test before you start the medication. You have to weigh more than 77 pounds. So if you are also a pediatric patient who wants to be on PrEP in Oregon, at any age, you can receive sexual health related care without parental consent. So if you are greater than 77 pounds and you want to start PrEP, that is available to you as well. You have to get tested for HIV every 3 months while on the medication, and you have to maintain regular follow-up appointments with your prescriber of the medication, just because there are some risks associated with the medications that we just want to keep an eye on during the process of your management of that drug. As I mentioned, there's 3 drugs that are available here. Truvada is the one that's been around the longest. It's a combination of 2 antiviral medications in one pill. It's intended for use in those who are at high risk through sex or injection drug use. So it covers a wide range of exposures that is well documented in clinical trials. It is not restricted to any specific groups. It's available to anyone as long as they meet those criteria that I mentioned on the other slide. And there are now generics available since it's been out long enough that if you don't have insurance, it's pretty effective, like cost effective, $30 to $60 per month without insurance in most retail pharmacies. There are like patient assistance programs through the manufacturer of the drug, though, that if your area doesn't carry any of the generics or has a hard time getting the generics and they only have the brand name, the manufacturer does have assistance programs that can help get you medication for a very low cost. Descovy is one of the newer PrEP oral options that are out there. It is similar to Truvada. It has the same medications in it. The 2 antivirals, just a slightly different formulation of them. So your body absorbs it slightly differently. It's only documented so far in clinical trials to be effective or most effective for those who are at risk through unprotected sex. It's not yet documented its safety profile or effectiveness through protecting those who are IV drug users. It is also restricted to certain groups. If you are assigned male at birth, so if you are a cisgender man or a trans woman or non-binary person who was assigned male at birth, it is FDA approved for you. All the clinical trials that were completed for Descovy were completed in that demographic. It was not tested in anyone who was assigned female at birth. So I'm assuming that those trials will come out soon. They are in the works, but for now it's only approved, FDA approved for those groups. And this one hasn't been out for as long as Truvada, so its cost without insurance is really high. But like with Truvada, the patient assistance programs through the manufacturer can help get you that medication at a low cost. The last one is Apertude. That one is the injection-based medicine for PrEP, and it starts with a loading dose, so you'll get a couple of frequent doses initially, and then after that, you'll just get it every 2 months at your doctor's office. It contains only one antiviral drug, but it's specific for retroviruses, which is the category that HIV falls under. Prices for this vary. It kind of depends on if your insurance will cover it or not. And you also have to take into account that you will have an office visit with that, because you have to go to your doctor to get that medicine. So any costs that are not covered through insurance or are out-of-pocket costs, that needs to be factored in as well for this medicine. So where do you go for these different kinds of medicines? For PrEP, primary care doctors or providers are the best option. It requires a lot of follow-up care, those frequent labs every 3 months. So the best option is just to go to your primary care doctor. But there are some other options if you don't have a PCP yet. In Eastern Oregon, we have EOCIL, which is Eastern Oregon Center for Independent Living. They are a community-based organization that help people manage their sexual health needs, I guess, in terms of appointments, connecting them with resources, and they also help connect resources specifically for PrEP as well. And so that may be an option if you don't have a primary care doctor and you want to start PrEP. There are also some online consultation services where you get assigned a licensed physician who will have like a video call with you, or they might do it just over the phone. It kind of depends on which one you select, but they will help manage your care, send in orders for those labs to get completed regularly. They'll send in the prescription orders to your pharmacy, and they'll manage that for you just completely through like a distance version of care. For PEP, going to the emergency room is the best option. So when you go in for PEP, you should really try to make sure that you got your first dose before you leave that same appointment room or exam room or wherever. For the emergency room, obviously like the exam room. Reason being, you have that 72-hour window, and if you leave there without your first dose and it gets sent to your pharmacy, you run the risk that they have it out of stock and they can't get it in until the next day. You have another delay potentially with, just them fill times, things like that. So any delays that you can push out of the way is always the best. And emergency rooms are connected to hospital pharmacies, which typically carry these medications. Urgent cares and some walk-in clinics may offer this service. They might not get you your first dose though at your specific appointment with them. And so ER is still kind of the best option for that. Planned Parenthood health centers do a lot of PEP and PrEP prescriptions, so they may be some options for you too. And then some primary care doctors may prescribe PrEP for their patients, but it's kind of just on an individualized basis. So you'll want to talk to your PCP if that's an option that they are comfortable with doing for you. This one's kind of my favorite slide here because it talks about the provider experiences with PrEP in. So starting with that top far one, the familiarity with prescribing PrEP. They did a survey of Oregon providers, and the responses said that 38% of your doctors, nurse practitioners, PAs, etc., are not familiar at all with prescribing PrEP. That's kind of a high number for, in terms of trying to prevent HIV in Oregon, which is one of our big issues at this time in terms of public health. So my goal in my work is to be that resource for providers to make sure that they get the education and training on how to prescribe PrEP so they're most up to date with it. When you have that knowledge, you gain that comfortability with doing it, and then it becomes a much easier process. The interest, though, for prescribing PrEP is really high. So it kind of just shows me that education is one of the big barriers for providers in prescribing PrEP. The desire is there, it's just the familiarity is not. So when we look at rural providers specifically, I thought this number really stood out to me, that 81% of those who were surveyed in rural areas said that they have never prescribed PrEP, never even touched the prescription pad or sent it in on the computer before. And that's really surprising. This medication has actually been out for a couple of years. And so the fact that this many providers haven't quite utilized that service yet for the community isn't where I would hope it would be. Urban providers are a little bit better in terms of having prescribed it before, not quite. But some of the biggest barriers that were noted in that study showed that it was too expensive for patients. This study was conducted in 2016 or 17, so it's a little bit older. There's a lot more patient assistance programs that are out now. So I'm hoping that that number in the next few years, if they do another survey, goes down in terms of it being a barrier. It doesn't look like it's a big barrier in terms of my experience with working with providers, so that's kind of beneficial. No electronic health records and availability to set up reminders. A lot of those frequent, management visits you have to maintain. Some patients are not great at remembering their appointments, miss appointments, have to reschedule. So it kind of gives a little bit of dysfunction there. And that's a barrier to making sure that you're getting the right kind of care while taking these medicines. Insurance might be a little bit of a barrier in terms of covering the office visits, laboratory orders to be completed. But that kind of sums up what that was for those years. I'm interested to see what comes out, that they do another survey to see what some of the newest barriers are. But they also surveyed some patients who had interest in getting PrEP, but were not able to get it. So they asked for their responses on some of their experiences in trying to get it. So some of these, it's a little bit grainy, I apologize for that, but this top one says, I had to convince my doctor I was adult enough to be on PrEP. HIV can affect anyone of any age. And so if that happened to be a younger individual, as long as they meet criteria, it really shouldn't be a barrier for them. If you are engaging in those high risk behaviors already, you're assuming that you're adult enough to take it, the prevention tips for that, and PrEP is one of them. The next one, my provider told me I don't need to take it unless I was dating someone HIV positive. That kind of comes from that lack of knowledge of what PrEP is truly intended for, and just general knowledge about HIV management. HIV tends to get managed by infectious disease specialists for a lot of patients. So primary care providers tend to send them on to those specialists, so they don't manage that as much. So some of that knowledge kind of falls through the cracks sometimes. And I wouldn't say that that's totally the provider's specific fault on that. It's kind of a system right now that is not the best at promoting these services. And so when it's not well promoted, it's not well utilized. And when you don't utilize something a lot, you tend to not know the most important. Next one down. First, you have to ask, then you have to convince the doctor that it's a good thing to do. So if your provider doesn't believe in or support this kind of option, it is a barrier for people to get this medication. And I think that some of the hesitation comes with the management of the, managing the disease, or excuse me, the Medicaid prescription of the medication and the labs and the follow-ups and stuff. And when you have kind of that lack of knowledge on what it all entails, if there's any confusion as to, specific factors that may disqualify people that aren't, were some of the ones I hadn't listed, there is a lot of confusion on how do I really do this for this specific individual. And so if you have to try to convince your doctor that it's a good thing for you to do, that just kind of maybe shows that they are not the most comfortable with it because they don't know the most. So this is kind of the summary of what is mostly currently going on for PrEP. But there are services potentially coming out through the different community-based organizations, and then there's some like national and statewide programs that are also good at trying to get providers to, be trained on it, get the education for it, patient education on the subject matter, and potentially decreasing organs, HIV rates, which are quite high right now. But specifically in Umatilla County, over the past couple of years, it's really reared its head. So, you guys have any questions?